Gautam Gawali. Regional directors from different regional centers of IGNO, academics from the different regional centers, academic counselors of regional center Mumbai, regional center staff, and my dear learners, a very good morning to all. At outset, I am very thankful to today speaker, the chief guest, Professor Gautam Gawali, for accepting our invitation and delivering today lecture, which is very much relevant in the present situation. It is on psychological well-being during COVID-19. As you are all aware, total country is under the lockdown more than 2 months, and this lockdown is going up to 30 June 2020. The situation the total country is facing, not only the country, across the world, the same situation prevailed, but whereas our Indian government also taking measures to stop the spread of this COVID-19, and recently also they have announced several taken several measures for the benefit of particularly migrant laborers and other people. But here it is very important one for organizing this lecture, particularly in this situation, because of the Indira Gandhi National Open University is a open distance learning university where we are having huge number of the students, and the students also pursuing their studies through open distance learning. Due to this COVID-19, all the study centers as well as the regional centers are under the lockdown. But however, we are providing student support services through information and communication technology. But however, once we have seen the mails received from the students, I thought students are under the pressure, students are under the tension, students are under depression, where particularly in the academic arena, educational institutions, students need the motivation to overcome the situation, whatever it may be the prevailed. That's why I thought to organize this lecture. And while I was searching for the people at the time, I thought Professor Gautam Gawali is the appropriate person, appropriate professor to deliver this lecture, particularly to our IGNO students. I am very happy and also privileged to introduce today's speaker, Professor Gautam Gawali. He is having a rich biodata. However, I am giving you his very brief biodata. Professor Gautam Gawali is a professor and a director of Amity Institute of Behavioral and Allied Sciences, Amity University, Mumbai. Prior to this, Professor Gautam Gawali was head of the Department Applied Psychology and Counseling Center, University of Mumbai, and he was ex-honorable director, ICSSR, Western Regional Center, Mumbai. He was with the Department of Applied Psychology since 1988. That means more than 20 years of the service he rendered in the University of Mumbai. He obtained his PhD in psychology from Dr. Babasaheb Ambedkar Marathwada University, Aurangabad, and he has delivered several lectures on international platforms and the national platforms. For he has visited UK, USA, and other many countries and delivered the lecture. Particularly, I would like to mention here very importantly, Dr. Gautam Gawali was invited to deliver a talk on caste mind by University College, London, UK. That is his credit. He is having the rich academic background, particularly in this psychology. He has written good number of research articles, and the same has been published in international journals as well as in the national journals. His specialization, particularly, he has done the very good research, well recognized research at international level, particularly in the field of rehabilitation psychology, mental health of elderly, health psychology, and the life skills. And he was the member in different administrative committees of the Mumbai University as well as Amity University, and he is a regional president of Indian Academy of Applied Psychology and member of many professional bodies. I feel very happy, and also it is my privilege to invite Professor Gautam Gawali for this particular lecture. I am very happy, sir, for having you in this occasion. I think the lecture which is going to be delivered by Professor Gautam Gawali will benefit and will make you stable related to your psychological situation during this particular COVID-19 situation. I once again thank Dr. Professor Gautam Gawali, and I request Professor Gautam Gawali to deliver the lecture, sir. Thank you, one and all.
A very good morning to all of you. Regional Director of IGNOU, Dr. Krishna, other regional directors of this esteemed university, Indira Gandhi National Open University, and my colleague from psychology, as well as students of psychology and all the participants of this webinar. Indeed, it's a great pleasure for me to interact with IGNOU students and researcher. And I must thank Dr. Krishna Rao for giving me this opportunity to interact with you. Since last more than 75 days, we have been locked down. The almost full world has been locked down. The day on which WHO declared COVID-19 as pandemic, the very next day, various government, even our government, central government, as well as state government, declared lockdown to protect us from this COVID-19. And during this time, the day on which it is declared as pandemic, people started thinking about how to face this pandemic, which is unpredictable. No one has predicted that this thing will happen. All of a suddenly, all colleges, universities, schools were locked down. people started giving different kind of responses. Like as a student of psychology, you all must have witnessed the kind of uncertainty created by COVID-19. Very unpredictable situation. Now, this natural responses came from the people. Some of them, they reacted to this pandemic as something which is very challenging. Like these are natural human tendencies that when you come across with any kind of uncertainty, any kind of situations which cannot be predicted, or something which is very unusual, difficult time. I think there are some people, like, see, you can stop their cameras, please, so that somebody is just trying to make some presentation in between on your mobile, so it will be little disturbing. So I will request all of you to please stop your cameras, so that I will be able to, my thought process will continue. So I request all of you, please just listen and stop your camera. Please do that. Mr. Kiran Kumar, please stop your camera. Yes. Right. Revati madam, Revati Kumar, please stop your camera. Nandalal, please stop your camera, please. Yeah, right. Mr. Nandalal, stop your camera. Okay. Now, this kind of situation which has been created, and then people started responding to this COVID-19. Some responses you must have witnessed by yourself as a student of psychology or researcher in the field of psychology, that some people started taking it as challenge. Now, what do you mean by challenge? Like, see, challenge means it is not something which has been overrated, or which is not underestimated. Like, and that's why it is called challenging. So we consider this as challenging. Some of them have considered this, or some of them have pursued this COVID-19 as very challenging. Some people you must have witnessed, and our observation state that some people have denial. Denial as a response to this COVID-19. Some people, they think that there is nothing going to happen, and there's nothing like pandemic. Okay, so they started denying this, denial. Okay, now there's a third group. Okay, which we have observed that they started giving responses as gain. Gain means something which, like, say, pandemic is declared. So this pandemic is something which is a gain, an opportunity to do something, opportunity to create something. So this is some the response some people have started giving, gain. And another response is strike acceptance. Okay, so this strike acceptance, Mr. Kiran Chauhan, please keep your camera off. Kiran Kumar Chauhan. Yeah. Okay, so people started giving responses, this kind of responses, like denial, challenges, gain. Some people have started giving responses, stoic acceptance. Stoic acceptance means something which we cannot change. Something has been forced on us, or external factors like goddesses has given this kind of thing, and we have to suffer. Okay, so this four type of responses people have started giving to pandemic 19. As I told you, challenging. That means people have looked at this as this is real challenge now, because I will have to face this challenge. Okay, so by not overestimating that this is a very big problem, or not estimating that it is not problem at all. This is what you call it challenging situation. So for some people it is challenging situations, and they are trying their level best to meet this challenging situation with their own way, their own personality, their own individuality, the way which they have developed themselves. People, those who have like denial, well, there are people, I mean, we can say they are the carriers of this COVID-19, because some of them have stated that there is nothing wrong in that, and there is nothing at the beginning. And the beginning they thought, I mean, denial, it's just like somebody has spread the message or something of that sort. This has happened at the beginning. Okay, so people, they were not responding to government's instructions. They were not responding to police instructions, and some of them were beaten by police. These are some of the typical responses given by the people, that I mean, denial, there is nothing wrong in that, and it's not going to take my life. Then this another very important, and which is very particular about Indian people. It is like what do you call it? Stoic acceptance. No, some external forces has given this, God, goddesses has written, or something which we have done in the past, and that's why now we have to pay the price for what unseen which you have committed in the past. Now these are typical responses which we get from the people. As a psychologist, we have to deal with this kind of responses. And then first, what we have to do when we have to maintain psychological well-being of the person. Okay, so how person react to this uncertainty, how person respond to this unpredictable, unusual, difficult time. Right. So psychologists, first what we have to do is to interact with them, and let us see that what kind of responses they have started giving. Right. And you know that, I mean, anxiety, stress, fear, these are some of the responses are very common. And according to psychologists, you all have studied, you know, very basic things in psychology, is that fear protect us, anxiety protect us, stress is a part of our life. You know, all psychologists have, they have mentioned that like stress, anxiety, fear, these are not the problem. Actually, it helps us to cope with, it helps us to live with our difficult time, right? But at the same time, it should be within normal, what we call optimal anxiety, optimal stress, optimal tension. Right, so these are certain things which you are very familiar about this. Okay, and that's why if anyone who goes beyond this control, beyond this, beyond his or her own control, then I think in that case psychological intervention is required. Right. So to maintain psychological, like, see, one thing which we have to keep in mind, that psychology being a social science, it has been created, like all social sciences have been created to solve social quest, social problems. So psychologists have a responsibility of maintaining community mental health of any quest, any problem related to community mental health or individuals' mental health. To solve that problem is our responsibility. Since we have opted for studying psychology, or we opted for this discipline, psychology as our discipline, as a career, right? So it becomes our responsibility, because one of very eminent social scientists, John Douglas, American social scientist, when he was defining social sciences, at that time he defined social sciences are created to solve social quest, right? And if you consider psychology as a social science, then it becomes our responsibility to identify what is a social quest which psychologists are supposed to solve. And social quest is psychological well-being of our society, of individual with whom you interact. Right? I hope it is clear. Is it? I am audible to all of you? Yeah, just you can respond one or two. Yeah, that's very good.
Yes, sir. Yes, sir.
Yeah, right. So, so this is what our responsibility to take care of mental health of our society, right? So now issue is how to maintain this psychological well-being. That's something which is very important. Now, this first what we have to, like say, I will share PPT. Okay, I hope there is a option available for this. Yeah. Yeah, just give me just few seconds.
I request all the students, please don't share in the middle. Only sir will share that screen.
Yeah, I think there's some. I'm just trying. Just give me few seconds. I think there's some technical difficulties I'm facing. Anyway, I'll go ahead with this. Like, see, first thing what we have to do while maintaining psychological well-being. Now, at this moment, I expect all those who are working as psychologists or those who are interacting with other people, and of course, I mean, we are supposed to interact with the people, particularly in this difficult time. And the first what we have to do about to help individual, like say, whom you declared as psychologically healthy person or psychologically whose well-being is adequate. So these are certain things which you have to keep in mind. First thing, self-acceptance. I will share this PPT. I have prepared the PPT. I will share this PPT with Professor Krishna later. Okay, but I think there's some sharing this is little difficult. Okay.
Sir, sorry for the disturbance.
Yeah, please.
The present screen is there, sir, that you can click, I think.
Yeah, I'm just trying for that.
Yeah. There is an option.
Yeah, yeah, yes, right. Window, yes. Okay.
Okay, sir. If you need difficulty, then
Yeah, I'll
I,
just
I,
see.
I will share with the students later.
I should have mailed it to you, but then I'm just not getting this sharing present now. Very bad screen window.
Shashank, where is that option
Yes,
in the
sir.
laptop?
Sir, it is this present now ka option hai, sir. That
Yes.
only you have to use present now.
Yeah, it is there. I'm clicking with this.
Hmm. So you can share your entire screen like that. You can share.
Yeah, yeah, I'm doing it.
Yeah, it is happening, sir. Now.
Now it is appearing.
Hmm. So now you can open the file, whichever file you
Yes.
wish to
Yeah,
present.
yeah.
Okay. Yes, sir.
Right. Can you?
Yes, sir. Yes, sir.
Next one. No, let me hear. Okay, I think there's some difficulty. I will go ahead with without PPT, right? So, yeah, am I audible to all of you?
Yes, sir. Yes, sir. You go ahead,
Yes.
sir, please.
Okay, so the psychological well-being, when you talk in terms of psychological well-being, so first thing what we have to do is we have to focus on self-acceptance. Now, this self-acceptance, particularly in this COVID context, in this, like, see, when I'm making this presentation, my focus is more on current situation and how this psychological well-being can be maintained, and what way psychologists can help people to overcome, to what extent we can overcome these difficulties, right? So self-acceptance is like a positive attitude towards ourselves. Like, there are many people when they meet with this uncertainty, like, let us take the example of how we shifted from offline learning to online learning. It was highly unpredictable for all of us, because no one could predict that this thing will happen, and how people, like, some of them had a lot of difficulties, doubt about their self, and some people had a difficulty to shift from offline to online teaching. And some people, of course, I mean, like few months back, in our counseling center, you all must have, because I know many of you, because your name appears on the screen, so I could see many of you very familiar to me, and some of you are my friend also, and practicing psychologists also, and you must have many cases reported to you saying that my child is having digital addiction, and we are addressing this issue, that how to help child overcome this digital addiction on mobile or a different kind of social media which they were using very excessively, right? And we were counseling them that how to keep them away from this digital addiction, right? And parents were worried about this, schools were worried, teachers were worried about this, and immediately after this, declaration of COVID-19, and then like, there's a shift from offline learning to online learning, and that times this has become little asset to people, like, say, those who are on having finger on their mobile. I think they adjusted with this shift from offline to online, so that kind of benefits we started getting. It is not addiction, but at least those who are very familiar with smartphone and other social media, so they were very comfortable in that learning process. So this thing, like 3 months back, we are counseling them for digital addiction, and now that has become asset for some people. This thing, of course, I mean, self-acceptance, but is one of the indicator of psychological well-being, right? So where people have very positive attitude towards themselves, they should maintain their self-confidence. Okay, so these are certain things which, and then during this time, instead of getting disturbed what is happening outside, right? So maintaining very positive attitude towards ourselves, that's very important aspect which we have to keep in mind. And some people, even, like, see, when they were familiar only with off learning, and then shifting to all on learning, so people, like, see, that kind of shift or that kind of transition required psychological intervention. right? And this is what you must have witnessed, because there are so many webinars are taking place. Many psychiatrists are very active. Psychologists have become very active. All mental health service centers become very active, and they all started helping our students and parents that during this transition shift from offline to online learning. Of course, I mean, I'm not saying that all of them got benefited by online learning, but to some extent, because see, in this given situation, online learning was the only option left, and people tried, at least in cities like Mumbai, Pune, and various cities where there's a access to internet connections and other options available. But there are many people like villagers, and they don't have any smartphone, or they don't have any access to any kind of internet. There's no electricity in many places even today, and these people are likely, and they have suffered a lot about this. So I'm not saying that offline learning or online learning is a perfect option for this thing, but in this transition, maintaining their self-acceptance, maintaining their self-attitude is most important part, which psychologists have been taking care of. Okay, that to facilitate the process of shift from offline to online. Then the people like see another thing said. So those who have psychological well-being, apt psychological well-being, adequate. So in this situation, they have that environmental mastery. This what is happening in the environment, what kind of circumstances are there, and how to have control over the circumstances. Like shift from offline to online again can be considered as a and then interacting with teachers, asking questions, involved in question answer session, right? So this kind of environmental mastery also is an indication of psychological well-being. And that's why many of us must have interacted with your own students, your own youngsters, your own children sometimes, to have to some extent control over environment. And then people see whatever opportunities are available. Like it's not that my child is comfortable only in school, but there are some parents also. They were not very techno savvy, but they also tried their level best to take this as an opportunity to help child shift from offline to online learning. And I could see, and many teachers also share their experience that parents themselves were learning how to go online and how to help a child be with teacher, interact with teachers, interact with other class. So these things are happening in city like Mumbai. Right, so they tried to have a control over changed situations. Now, that's another very important aspect is positive relations with others. Now, one side, in COVID-19, that concept people have coined social distancing. I think social distancing is not an appropriate term for protecting ourselves. Social distancing, on the contrary, it should be physical distance. People they talk in physical distance, or they should not be entering in a crowded places and should not organize any social or anything of that sort. Probably in that context, this particular. May I request Dharmaraj Kharat to please keep your camera off? Yeah, because there are a lot of movement in your camera. Please do that. Thank you so much, Doctor. So this positive relations, particularly in Indian context, when we have a lot of discrimination, social discrimination on various grounds, and still if you propagate this idea of social distancing, I think this is not a very well idea to get along with our psychological well-being. The basic tendency of individual is to be with others, to understand others, to deal with others, to interact with others. We learn through interaction. So this positive relationship has to be maintained, and that's why government also identified or recognized that there's a something with like person who has been identified or diagnosed as having COVID-19. People, they look at that whole family is discarded. Family experience a lot of discrimination, rejection, non-acceptance. Okay, so these kind of things are more related to maintaining social distance. So it should not be social distancing. On the contrary, government is asking that, I mean, please see to it that you are helping these people, trying to understand their difficulties. Many of them were not even aware that how they got infected because of this COVID-19. It was not an intentional act by themselves, but because of certain infection somewhere, I mean, they catch the infections and they become victim of this coronavirus. Okay, so this positive relationship, maintaining understanding, empathy towards others is also equally important, because we have been, as a psychologist, we have been struggling to have this kind of interaction before COVID-19 also, and we are allowed to continue after COVID-19 and during COVID-19 also. That social distancing is not the appropriate term. Physical distancing, yes, okay, but at the same time, we have to provide them, because there are many people, I mean, they give information, like we are bombarded with many information. Some informations are like, say, misinformation, fake information, right? Wrong informations are passed, and that's why government has to take decision that to stop this WhatsApp messages people were sending, forwarding to each other. Okay, and that was creating a lot of problem, because if you want to take this as a challenge, COVID-19 as a challenge, then we must have appropriate informations with us. We must have adequate information given to us, or information should come from very authentic source, so that this information can help us to deal more effectively to this pandemic. And that's why we need to have appropriate information, the authenticity of source of information. Okay, that's also equally important to know, because our response depends upon what kind of information you have with you, right? Otherwise, there are people, I mean, they give some false information, misinformation, sometimes fake information, and because of this, there are many people, I mean, they started reacting with very excessive fear, phobic kind of this excessive fear. Okay, and that's fear psychosis is created by the information. And that's why if you have an appropriate relationship with others, and then get this accurate information from each other, pass accurate information to each other, I think will help us not only to by maintaining physical distance, you will be able to get ourselves connected with others, because our psychological well-being depend upon how you interact with the society. Then this another very important thing is that purpose in life. Like, say, there are many people, like, say, for example, those who are studying in 10th and 12th standard, many of them had planned their future. Some of them wanted to go for engineering, doctor, medical, and other services. Some people were trying to go abroad after completion of their graduation, post-graduation. So this career also has, because this word of work got changed because of this pandemic. Now there's a lot of uncertainty, there's a lot of unpredictability. Many of students, I mean, they contact us, those who have already tested their aptitude, and they found that they are suitable for this particular occupational field, and they identified some of the very institutes abroad or in India also. So because of this COVID-19, I mean, they cannot execute their plan immediately. But I think if they can hold on for some time, things will be normal. Okay, and then I think they should. But this kind of confidence has to be generated in their mind, and psychology has a very important role to play with this kind of situation, where our young generation, because you know that our country is a country of young people, and we had this national youth development policy. There are many things have been committed by the government. okay, which has been passed. The National Youth Development Policy has been passed somewhere in 2013-14. A year. So this our youth has become an important source for word of work, and due to this pandemic, word of work has got a lot of it has been disturbed because of this uncertainty, unpredictability. And people, I mean, they don't know now. Every day online students are asking, so what will happen to my career? I want to go here, I want to go there, I want to pursue my career in this particular field, and now online it is not possible, offline only it is possible. There are many queries we get from, and then because of this they are totally disturbed. They are having a lot of anxiety, stress, tension they experience. Their parents also are suffering from a lot of tension and anxiety during this, because word of work, or say what you call it, career counseling, is also equally important for this. And that's why we call it goal orientation. It's a purpose of life, that they should be having goal in their mind. But this pandemic is not going to be there for a longer, because all the scientists in different part of the world have started working on it. There's a possibility that you may have vaccine as early as possible, and then things will be again normal. I think this kind of confidence needs to be generated in their mind, with, of course, very appropriate and adequate information needs to be provided, because they should not compromise on their career plan. They should have a goal orientation. They should have a plan in their mind, so that after this difficult time, they will be able to enter in their respective occupational field. So this kind of things also will help, not only that concern youth, because as I told you, youth, particularly in India, because we are just 25, 28-year-old. The whole world is becoming elder, becoming old, but India is becoming young, and this youngness of India will continue for another 10, 15 years. And this, our young generation is going to be a tremendous source for our economic development, social development, not only India, but the whole world, because we are going to be source of human resources to the whole world. And that is what I mean, during pandemic, as a psychologist, we'll have to really focus on this particular issue, and we'll have to counsel our youth by assessing them, by interacting with them, right? Otherwise, like say, otherwise they will have a lot of anxiety, stress, and they will they may become deficit, they may lose self-confidence, okay, and they may think that future is very uncertain and will not be able to create my position. So negative thinking, about their creation in the world of work, their own creation in the world of work. So these kind of things can affect not only their psychological well-being, but psychological well-being of whole family, and ultimately society. And that's why washing hand is not the only solution. We'll have to help them wash their negative thinking also. Wash their, like say, whatever that fear, psychosis which they experienced during this time. So along with washing hands, I think we'll have to wash their minds also, so that as far as possible, and this is a very important role which psychology has to play. And I must thank Professor Krishna Rao for having this kind of interaction with our young students and our young researchers and our colleagues from various parts of this country. So this is another thing. And then in psychological well-being, there's another very important things which we have to keep in mind. Like see, there are people like, so those who, a lot of studies are being conducted. People are assessing those who have experienced stress in their life earlier, before this pandemic. and they started responding this pandemic in a very challenging way. There's no and they are becoming very productive. There's no compromise on their productivity. There's no compromise on their efficiency. Okay, even online or like say offline, there's no difference for this. Now these are some of the things that those who have experienced, and that's what now this is a very clear-cut evidence that those who experience stress, they have they don't have any difficulty, or they at least cope with this kind of pandemic, right? Because they have that, we call it stress inoculation, that concept introduced by the psychologist, stress inoculation, that those who have experienced anxiety, frustration during their life, they had this become asset for them to deal with this kind of unusual, difficult this thing time facing this. But of course, I am not proposing that idea that a lot of stress also is not very healthy, because person is continuously facing frustration and stress. I think their psychological well-being get affected. So everything should be within the limit, optimal, right? So this kind of things, like say we have resilience. That's another very important concept, because we all know that how we define resilience. Resilience is defined as patterns of positive adaptation in the context of significant risk or adversity. Now, see, this is significant risk and adversity which we are having today, and then we need to build this resilience among the masses, and particularly my focus is more on youth development. We could talk in terms of, nowadays people have started talking about positive youth development, right? So where competence, confidence, and other aspects are equally important in this, and that's why this kind of things which we have to keep in mind, that how to build resilience among them, because we have that concept called stealing effect. I think you must be aware about this stealing effect, where people normally when like say they experience difficulties in their life, they come out with more strong, more healthy. Okay, so that is what you consider as a person with resilience, right? Right. If you like a steel metal, if you hit that metal, so that metal become more stronger, and that's why it is called stealing effect. Stealing effect. Okay, so that's what the perfect example of resilience. On the contrary, this resilience concept itself originated in that stealing effect concept. Okay, so these are certain things which I wanted to discuss with you. There are many things can be discussed, but I think it is 10:54 according to my watch, and I've been given 1 hour talk, so I can respond to some of your queries, questions if you have related to this particular issue. So thank you very much for such a wonderful participation and patient hearing. Thank you so much.
Thank you. Thank you very much, sir. So, as sir has permitted, students may ask, means 2-3 queries will take related to today's lecture. If anybody has any doubt or any query they want to ask, sir, they may ask.
Shashank, instead of they ask, if they want to ask, they can type in the chat box. You can call that particular student. That is better.
Okay, so
Yeah, I'm just looking at this chat box. There are some questions coming. Yeah.
Yeah, you can call the student.
Janvi has written some question. Janvi.
Yeah. They can ask questions if you want.
Yeah, Janvi, you can ask your question.
Unmute yourself and then ask questions, Janvi ma'am. Yeah. Acha, you just her audio is not working. I think she is in the message. You please message your question. Yeah, there are many people. I mean, writing that they want that they like the concept of physical distancing. Okay, that's something they are giving compliments. Old people are finding difficult to stay at home. I think these are some of the issues are being raised by the participants. Okay.
Yes. And in fact, sir, one learner Saurabh Mukherjee is writing how to counsel the kids to
Yeah.
remain inside the house as they are becoming very impatient spending time inside the house.
That's very challenging task. Yes. Just who has asked this question?
Saurabh Mukherjee.
Dr. Mukherjee, okay. See, I know it is very difficult because this is a time because why child should be kept in at home and they should not be allowed to go out because this is something which is very unusual for the child's development. I fully agree with you, and you must be having a difficult time to control them, to protect them from any kind of infection outside. Okay, I think if children are of a particular age, they can understand, but those who are below the age of 5 years or around 3 years, they must be having a lot of difficulty. So we suggest that you can have indoor activities, you can have some game puzzles and something of that sort. Please keep them busy at home, interact with them, try to understand them. You have many other things which you can keep them engaged. Okay, but of course, I mean, interaction with others and playground has a different meaning for this because their all-round development depend upon interaction with others also. That's equally important part. But let us hope that, I mean, we try our level best to keep them engaged at home by different kind of activities.
Sir, can I speak?
Yeah, please.
Sir, this is Dr. Kharat from SNDT.
Okay, Dr. Karat, how are you? Yes.
How are you?
Please.
Good,
Yeah.
sir. So,
Yeah.
my question is, media is making us mad,
Right.
and at the same time, you people and so many other clinical psychologists are advising to be very positive. To be positive means what exactly one has to do, and
Yeah.
what are the ways to be positive, and what are the steps to be positive, because I can give several times the command to my mind I should be positive, that nothing is going to happen. There is a fear in the mind,
Right.
and that's why people from Mumbai, Pune, and the metropolitan city, they have went to their hometown,
Right.
and hometown is also not a safe place. No place is a safe place, and
Yeah.
we cannot hide ourselves anywhere else.
That's
And
true.
so neither we are safe in city nor we are safe in a town. So where to go? And moving is not a only solution. Again, if I go to village, then again the quarantine will be there. For people from village, they are coming to city, again the quarantine will be there, and quarantine is like 14 days jail
Right. Right.
of
I
no
understand
fault.
it. Yeah.
uh,
Like, say, in this given situation, like, say, people, those who are, like, say, depends upon how active they were before this pandemic. And I fully agree with because a lot of exposure to
mm,
negative news and negative media. Sometimes, people have started. Now we have to tell people that, I mean, you start sharing positive things also. And now some of the medias have
mm,
started sharing positive things also, that how many are recovered, how many are suffering, how many are I mean, out of danger. Now, this kind of informations also are equally important. And then we'll have
mm,
to focus that what kind of information we process. Some people have, like, say, we call it negative thinker, positive thinker. Like, see, that also because there's a basically something, some people have that predisposition to process negative thinking more than positive thinking, even in the family also. If anything
mm.
happens wrong, they don't pay attention to positive things, they pay attention to negative things, and that makes themselves also disturb their mental state. At the same time, they disturb the mental state of other people also. So that
True.
negative thinking is highly infectious. Okay, so let us see that we think positively in this situation, and as far as possible, don't expose yourself too much to media and too much to news and other things, because we have A to Z channels, and if you keep on shifting from one channel to other channel, and then there are negative news also. Sometimes wrong informations are provided. Some people, they build unnecessary externality in your mind, so that also is disturbing, which can disturb your mental health, well-being. So it is better that your thinking style needs to be changed. I'm not telling you this because you must be asking question on behalf of your students. Okay,
Right.
so that we have to keep ourselves as far as possible goal oriented, to face this challenging situation, because some people will definitely come out to be very strong after this, and that's what we call it resilience. Okay, so this kind of things people have started, and some of politicians also say that it's an opportunity for us to grow. I think these are certain things which we'll have to introduce in their mind, so that they will be. And say shifting from one place to other place, then again there are many infected contact points. There's a possibility that we are taking risk of shifting from one place to other place. Also may create a risk. So it is better that wherever you are, you must try and protect yourself and protect also from this kind of infection. Yes.
Right.
Yes. Right.
Thank you, sir. Thank you so much.
Yes.
Sir, here one student has written about the old people are finding difficulty to stay at home. They are having already geriatric problems. At the same time, they are having this psychological issue also now. It became more as they are staying at home. They are unable to go outside. Previously, at least they were going outside some parks or spending some time. Now, due to this pandemic COVID-19, they're getting two simultaneously. One side geriatric problems, at the same time psychological problems. How they
Yes.
can overcome this?
Yeah, like say, as you very rightly pointed out, elderly, according to some psychologists, they say that it is second childhood. And as the earlier person asked this question, that how to deal with children, I think same thing, because elderly also have that kind of interaction, needed that kind of interaction, so that they can have that reality orientation, what is happening outside. Okay, so that reality orientation also is equally important to add to their like say life to years. What life to years is a very important concept. Like say they've experienced that isolation, withdrawal from others. This thing, people are not interacting with them otherwise also. So there's a possibility that there's sociability, that fostering sociability that needs to be done. But now in this COVID situation, and all physicians and scientists have declared that due to low immunity of elderly people, I mean, they should be like children, and elderly people will have to protect them, right? So this is a reality of life. So we'll have to help them accept the reality, and as far as possible, like children, you must, elderly people also should be kept busy. They can keep themselves connected with the people telephonically. They can go on email or WhatsApp or on Skype. They can be allowed to talk to each other. So that kind of fostering sociability also is equally important, so that they should be kept busy in certain hours, so that they are connected with people in general. And even their other things, like see their banking, their other finance management and everything, that also sometimes we need our other family members to take care of this. Okay, so fostering sociability is a most important aspect for elderly people, so they can be in touch, as I explained you, as they can be in touch with others, their friends, their relations, their relatives, their other, like say their niece and nephew, wherever they are. So I think they should be able to talk to them. So by by this way, we are orienting them with the reality what is happening outside, and at the same time fostering sociability so that they can be to some extent comfortable wherever they are. For fostering sociability is very important aspect. Elderly people.
Yeah, thank you, sir. Any other student want to ask?
Hello.
Mm.
Yeah.
Yeah, I have a question. I mean, like yesterday, I am a student of psychology, I mean, like first year of psychology. I just wanted to ask you, like yesterday I was traveling and there was a rickshaw wala. I mean, like I was sitting in the rickshaw, and the rickshaw wala was asking me because he was very scared with the situation, and he was telling me कि मैम हम लोग बहुत गरीब है. I mean, like I said okay fine. So then he was asking me कि ma'am what is this called? I mean, like is there any precautions or any medicines for all these things, or when the vaccine is going to come and all? He didn't know the vaccine and all. I told him about vaccines and all these things, but he was so worried, and he was telling me that nobody's touching me, nobody's talking with me. The regular customer who always travel by rickshaw, even they are not talking with me. He was mentally ill that time. I mean, like he was not understanding like how to I mean, like what I have to do. Even he was talking about his rent and all, and he was telling me ki when this is going to end. I mean, like he was so, I mean, like how to help this kind of people. I was very upset. Even I did not understand how to help with this. I mean, like this query with him. So I mean, like I just told him to just keep hopes. It's okay. Everything is going to be, something or the another thing will come. Some vaccine will come. So don't worry about that. So he was like, कि, yes, ma'am, ये सब कुछ ठीक है. लेकिन what about? I mean, like हम लोग अभी कुछ कमाते नहीं. What about that? So I mean, like how to help this kind of people. I mean, like I was actually very silent that time.
Right. Yeah. I think Prajakta, right?
Yes,
Yeah,
yeah.
Prajakta, I really appreciate your sensitivity.
Thank you so much.
Because these are some of the very important issues, because we need to look at this issue from not only from psychological perspective but from other perspective also, economic perspective also, right? There are different ways, and then government also should come out with some policies to protect such type of people, those who are directly affected by this pandemic. And in addition to this, I appreciate the way you interacted with this person. Like, see, and that kind of hopefulness needs to be introduced in their mind, because otherwise they will become totally hopeless, and then their life may become very, very difficult for them, right? See, it is not only that, but because of wrong informations, because of the training which we have to give to people now, it is not only rickshawalas. Now lockdown has been released in many places. There's no containment now in some places, right? And then we have started, like, see, in psychology also we have some concept, like, see, if there is any terminal illness, like, say, for example, arthritis or any kind of terminal illness where we have to, there is no treatment, proper treatment for this. So in such situation, we help people to cope with, to live with this kind of condition. Okay, like for example, diabetes or some blood pressure and all. See, these are certain things which we'll have to train them to live with. Same concept we have to introduce here. To, like, see, we don't know exactly how long this pandemic will continue, and I'm also hopeful, like you, as you said, that things will be normal soon. So vaccine will come, and then things will be completely changed. And this thing has been done in the past history also of a human being, where they had this kind of difficulties. But at this moment, we have to cope with, we have to live with. And that's why we need to train masses that how to keep physical distance, okay, how to protect ourselves. And then instead of having doubt in the mind about other person, like he said that no one touched me, no one, there's no question, because he should be informed that it is not that you are you are protecting by not touching. You are also getting protection from others. Okay, it is not that you are infected and people are avoiding you. On the contrary, the other person who is traveling up in his rickshaw, there's a possibility that person is affected, and if he touches you, you also get affected. So this kind of idea, this kind of appropriate information, adequate information should be provided to them, so that, and we'll have to prepare them mentally to cope with, live with this kind of condition for maybe few months.
Yeah, thank you so
Sir,
much, sir.
sir, again a question I'm asking you.
Yeah. Yes.
Psychological counselors are there,
Yeah.
and they are telling the people to be positive, think positively, this, that. They are counseling the people. It does it mean that they themselves are not scared about this pandemic COVID-19?
You are asking very good question, because psychologists are after all. Yeah.
And in continuation to that, at individual level, what we should do, do's and don't, and so far student teacher relations and teaching learning is concerned, what are the things we should do and what are the things we shouldn't do? So on that, please you focus. So while we interacting the students, how should we begin the talk? How should we counsel them? How should we bring them on the proper track? And how can we remove the fear from their mind? So if you speak something on that, that will be better for us.
Yeah, we need one more session on this. But anyway, I'll just, there are two parts of your question. First is, are psychologists afraid of this? See, psychologists, after all, they are also human beings. Okay, all emotions and feelings they do have, right? And there's a possibility, like a person who is like a physician who is working with HIV/AIDS, there's a possibility that he may develop HIV/AIDS, because it can be considered as a professional hazard for him. Right, while working with. So while working with people having anxiety, fear, they also experience anxiety, fear, sometimes excessive fear. Okay, and they also should protect, like as physician has to protect himself, they also should protect themselves from this. And since they have opted for this particular profession, okay, so instead of like say bombarding with only positive thinking, think this way, let us change the thinking style. Thinking process, that's more important for this psychologists. And to psychologists also. The other question which you are asking about, the other part of question is that, I mean, students. No, as I told you that there is an unpredictable situation, uncertainty about their exam. No, they are. This is all but natural state of mind. Okay, so in this situation, I think there are many perspectives to look at this, from examination point of view, from government policy point of view, psychological point of view. Okay, there are various ways that we'll have to look at this particular issue. Okay, so dealing with the students. But now situation is, let us cope with, because we are now teaching and learning through online. It's an option being created. Right, and if you keep them busy in learning and teaching, both teachers and students, I think their attention can be diverted from this. Otherwise, they will be constantly thinking about what is happening around. Any kind of, I have been like every 15 minutes, people are going on WhatsApp. Is there any positive news coming? Is there any things happening in our area? Okay, and then Arogya Setu, but they are visiting this, and then they get scared also sometimes. So I think we'll have to gear up in such a way that we should be helping this masses in general, that how to process the information. Okay, what kind of information should be processed, and which informations are disturbing you and others. Okay, that also, and like particularly children and elderly people, will have to really look after them. This is the right time to take care of them. Right.
Sir, I have a question for you. Good morning, sir. Sir, this is on behalf of a teacher. The teacher is actually not scared of getting COVID, but is extremely scared of isolation. 14 days quarantine alone from a family, and it has become so paranoid and so obsessed with that no sleep, and it is gone to the highest level of anxiety, depression. What is your advice for that person, sir?
So, ma'am, I fully agree with you, because sometimes treatment is more painful than the illness. Okay, so for keeping them in isolation, okay, is a things which we have to protect them. Okay, so that needs to be, because sometimes when internal standard of children or internal standard of any individual to assess the information or evaluate what is good and bad for them, if they find it little difficult, so external force like teacher and psychologist should help them to interpret the information in appropriate manner, so that you can keep them busy. And I think this online option is created keeping in mind that how to keep them busy. And I'm sure that, I mean, children cannot be kept continuously on this screen for a longer time. So there should be some gap in between, so that they will be able to. Otherwise, then not only this psychological difficulties, anxiety, stress, that isolation make them more insecure about the kind of they will, and then they will not be able to focus because of anxiety. They will not be able to understand anything, and that's why it is better that, I mean, we maintain their mental health in such a way that they are given flexible time for this. When teachers also, while teaching, some flexibility should be there. Okay. On the contrary, there are some positive things happening, because there are some schools, in district level, when there are no appropriate or infrastructure available for them. Even some teachers are not available. So city like Mumbai, Pune, where teachers are supposed to be very competent, and they are competent. So this competent teachers can interact with such students, so that their way of learning, their motivation can be increased further. Right. So this any kind of learning cannot be without motivation, and that maintaining motivation is most important aspect which psychologists can take care of.
So you think that this type of anxiety disorders can be controlled with proper meditation, or relieving stress can be done with exercises and all those things? Because you will not be able to do your work properly, right? If you are continuously under anxiety of isolation.
See, isolation may create difficult. Like, see, there are two ways of looking at isolation. Like, see, person, those who have very high level of internal standards. So isolation, they can block by reading books, involving themselves in all kind of learning activities, and they can learn many things. I have witnessed many people, I mean, they were not technologically savvy. Because of this shift from offline to online learning, even teachers, I mean, those who were not very well versed with technology, so they could learn that technology. I have seen many elderly people also, I mean, they started interacting with people online, like Skype and other things, so all media. And now also, like any platform, we have little difficulty at the beginning, but we adjust with a different platform, online platform. I think there are many such platforms available where child can be taken on, and then as far as possible to maintain their anxiety. Otherwise, if their anxiety is more beyond control, their focus will get disturbed. They will not be able to focus on their studies.
Okay, sir. Thank you.
Thank you.
Hello. Hello.
Yes, Karuna ma'am. Yes.
Yes. Sir, I want to ask one question here. As I am a counselor and psychologist, so dealing with the people with mental health and presenting webinars. But during this period, what I have observed that many of times we are having the questions about the children, we have questions about the related to the adolescents, questions related with the elder persons. But while doing this case study, what I have observed that all the mothers, I mean the women are also concerned as they are correlated with this thing. So nobody has arised any question about the woman. Okay, and I can feel that what face they are facing right this time. So because many of the women they are doing the household work along with their work from home, office work, and the cooking and everything. They are handling elder persons, they are handling children, they are handling adolescents. Adolescents, they are getting the counseling from the colleges, and other persons they are also. But women, they are not getting any type of the counseling, any type of the instructions and nothing. And so I want to know about from you that how can we have these women, though they are not saying herself about themselves, but I can feel their pain while going through the case studies and all these things. So I think we need to do something about the women also, as we are not presenting anything, any webinars for that. So will you please help me in this matter that what exactly I can do for them?
Yeah, I think this is a very relevant question we have asked about this, because, and I fully agree that, and people, we have started only thinking about youth, or any other, but women folks, the kind of difficulties they must be facing at home, when children at home, whole families at home, elderly people they're at home, and taking care of all of them. They must be physically tired, mentally also a lot of strain, and then kind of fear that what will happen to my child, what will happen to my other relatives, and this kind of tension and anxiety they must be experiencing, no doubt about it. I fully agree with you. And we must, like, see, on the contrary, now when we are we counsel that, I mean, everyone should share the work at home, and people have that tendency of like, say, homemaking as something which is unskilled, or rearing children is something which is unskilled. These are the problem of our society which we have been struggling to deal with. Okay, so I think now people, those who are at home, also can realize that how important it is and how difficult it is to rear the children, and how to take care of homemaking or homemaker, whatever that concept. I don't think it is this concept is coined by the women. These are the concept coined by the men only. Now they call it first housewife, then homemaker, and now they call it domestic engineers for them. Now this is just so unreasonable, like, see, what you call glorification of that things. Okay, which we have to look at as that particular issue from social psychological perspective. And I fully agree with that. They also should be given their own space. Okay, and even at home also now, all husbands are there, children are there at home. I think they should try and understand each other's difficulty and help and share the work, so that this is a time for them to learn what is housemaking. This is a time for them to learn how is cooking, and the other household work which one has to do. I think that work also has to be shared, so that at least physical stress can be taken care of. Mental stress which she is experiencing, because society expect them that if something happens wrong to children, mother is likely to be blamed. I think that particular idea needs to be changed. Okay, so whole family, husband and wife, both should be held responsible for the mental health of the children. And now I think what you have observed is perfect, because as a psychologist, we'll have to look after the mental health of all the family members, and not only what we were discussing about elderly and children and adolescents, because our focus is more on that. Okay, but I think what you said is correct. What your observation also is correct, that our focus also should be women in general, because they have some their own difficulties, sometimes created by others.
Okay, thank you.
Sir, hello.
Yes, please.
So, regarding this, I want help from you that any platform can we provide for the women, so that we can actually provide the strategies for them, not the things, that thoughts or the points we are sharing, that think positive and all these things. Yeah, it is appreciated, but the thing is that what is actually strategies to deal with the children and everything, how to prepare their mind, how to prepare the elders' mind. Can we work on that, and can the RC can help me to present this platform, provide this platform for the women also?
Why not? Why not? You can have this, because there are platforms dealing with small children, adolescents, youth, elderly, people with disability. Okay, so we can have platform for them also. What is that? But it is not that psychology is different for women or men. Psychology is same. Okay, so keeping in mind this, don't create the separate psychology for women or psychology for men or psychology for disabled and psychology for able-bodied. Psychology is same. Okay, so let us have that. Some issues, of course, I mean, you can raise, you can discuss certain issues on some platform, especially for women. There is nothing wrong in that, because we have literature available for more for women. I don't know why, what is the reason behind this, but I will find that in library there are many books available that how to counsel women, and there are no books available how to counsel otherwise.
Okay.
Otherwise means men.
Yes.
Okay.
Thank you.
Thank you, sir. Thank you very much, sir. Now, last question we can have, if anybody has any other question. Last question for this session.
Hello, this is Harish. Harish here.
Yes, Mr. Harish.
Sir, interesting session. Thanks for your time. Just one question. Data suggests that the divorce rates are on the rise during this lockdown and because of this COVID situation. So, what would be your suggestion to couples?
Okay, that's a very interesting question. I think somebody has appeared on the screen. Hello. Yeah, right. Mr. Harish, we defined marriage, or otherwise also before COVID or COVID also. As a psychologist, I can say that whole marriage as an institute or family as an institute was in trouble, is in trouble, and will be in trouble. Okay, now for what we have to do is that how to counsel, because many of them they don't know the basic definition of marriage, because separation is otherwise also the divorce rate is increasing in our society. So the marriage definition is that people should accept that they have to live with different. Like, see, marriage is something which two different people coming together. So moment you start valuing the differences, there will be no, I think their problem can be minimized. But when you start that, I mean, why can't my wife think the way I think, or why can't my husband think the way I think? I think this is going to create difficulties in their marriages. Now, continuous contact at home, otherwise people, both of them were working, or someone was working, and then at least 12 hours he was out, or 8 hours he was out, or she was out, and now they have staying together. They have been forced to be at home for 24 hours. Okay, and that too for 75, 80 days we are locked down. So sometimes what happened, it is not that their marital difficulties, but because of their mental health issues, their own mental health issues also can create difficulties in their relationship. It is not only marriage is responsible for this, but their own difficulties, their own intra-psychic problem, what you call, that needs to be addressed by the psychologist.
Right. Sir, one suggestion. Can you conduct, I have a suggestion and request to Dr. Rao also. Can RC Mumbai IGNOU conduct a 5 days certificate program, so you can send COVID-19 counselor ambassador through RC Mumbai? Because if teachers and the people join to RC, if they are properly counseled and given proper certification, they may go in the society and they can be guiding the other people and counseling the other people. Is it possible to conduct 5 day session? My suggestion, my request to you and Dr. Rao, if it is planned out, then we can happily join for that.
Yes, sir. Actually, even I was planning to tell you that only. Thank you, Dr. Dharmaji, to telling this.
Thank you.
Yes, I agreed that if
Please.
you provide that. So asking for platform was, I actually mean to that conduct some webinars and seminars for all.
Yeah, true. Right, Karuna.
It's a policy.
I actually love this session. I mean, like, this is amazing session, and like I actually
very
want
good.
you to conduct at least whatever Dr. Dharmaji said. Please.
This will be the actual model for the counselors and psychologists to deal with the reality factors.
And that should be focusing only on COVID-19 counseling.
Yes.
Yes, yes. We will plan. We will plan with the discussion of Professor Gautam Gawali. Then, yeah,
So if it is, sir, Rao sir,
yeah,
Dr.
we
Rao,
will speak on that one, please.
yeah, yeah. If it is 5 days program and 2 hours each day, then that will be beneficial to us as well. It will be a social responsibility of us to spread happiness and counseling among the people. Because if you see outside the society, there are a lot of yeah, anxiety and people are not comfortable. So if we speak to them positively, then I think things will be better. So this is just a request. How you plan
Yeah,
out? You please let us
it
know.
is noted. We will discuss with Professor Gautam also.
Yes, sir. And it was a wonderful session, very informative, thought-provoking, and each and every query and doubt problem is being answered by Professor Goli, sir. And thank you
Shashank,
so much for the
yes.
regional RC Center, Dr. Rao, and all other committee people, the team of IGNU. Thank you so much for arranging such a wonderful speaker and the session and the topic. And
Yeah,
active
actually,
party, I
thank
must
you.
thank to active participant Prajakta and Karuna and all others and
Thank you
everyone.
so much. And thank you.
Bhagwan
Thank you.
sir left. I want to ask one question, important question of being a medical person.
Yeah, Dr. Kanti, right. Yeah, please
Sir,
go ahead.
I am, yes, sir. I am working in a hospital actually. So people are not allowing us. I mean, not from our category. People in the whole house society also. There is a mental trauma being in the hospital dealing with the COVID patient that we are very close to them, and the society people are forcing us not to be at home. And since there is a, we are in between, our kids are at home. We are working there. We are dealing with those patients. We have to face society. This is a this dealing pressure on us. So how to cope? Actually, initially it was very much. Now we have come up with that also. We have settled now.
Hmm.
But now so
Yes.
many people for the nurses they are taking out from the society. They are not allowing to come in the house. So we have home
The
tension also plus as well as working place also. So can
Kranti
you
madam,
please
it is
help?
like you helping the society and society is not helping you.
Yes, sir.
Yeah. Yeah, Dr. Kanti, I
Society and
look at
society, both from both here we are in mid. Working for
Yeah, yeah,
them and
got
we
it.
are taking to them also.
Very sad
yeah,
it is.
yeah. Dr. Kanti, I just look at your issue which you have raised. I think, say, by being careful and by being paranoid, there are two different things. So people should not become paranoid about this. So what your response is a like a paranoid response given by the masses, or sometimes even family also, or place where you are staying, you are visiting. I think this is what psychologists should focus. That I mean, it should be very realistic while this thing. Otherwise, people will become very paranoid about. Okay, so that fear psychosis is created sometimes by person themselves or by media or wrong informations which are given to them. So, Dr. Kranti, your issue I can understand because we have been watching news and there we could see one doctors and police and other this thing. Okay, how their family members also sometimes become very paranoid about their perception about your presence in that vicinity. Right.
Uh, Sir,
Thank you, sir.
thank you, sir. Anyhow, formally we are closing this session.
Yeah, just one second because see, I will just give my last remark after this question answer. I'm very happy that I mean the kind of questions which you all have raised. Sometimes it is little deviation from a topic which was given to me, and I also accepted this. Okay, but good that I mean it was a learning experience. Very relevant questions raised by all of you, okay, and practical difficulties. And I really appreciate the sensitivity on the part of some of you towards some population, some group, those who are really affected by this pandemic, women, rickshawalas, taxiwalas, and other things, children and elderly. Wonderful, because this is something which is actually we are experiencing outside. It's not that it is something which is a discussion in the laboratory, but it is a discussion in the community, what is happening. And that's why to have knowledge about everything, because that reminds me, Buddha once said that, I mean, like, see, there is no wealth like knowledge, okay, or no poverty like ignorance, right? So best wealth is knowledge, and poverty is ignorance. So I think what Dr. Kranti asked this question, there are many people are ignorant about this, and that's they're likely to face all these health workers are likely to face these difficulties because of their ignorance. Their ignorance means ignorance of other people about this. So with this, I thank for your wonderful participation, and it's a learning experience for me also to interact with you. Thank you so much. And I thank Dr. Krishna Rao and his team and whole this regional center for organizing this wonderful meeting. Thank you so much.
Yeah, thank you, sir. It is a wonderful session and meaningful, thought-provoking session where the participants also actively participated. It is a very good session, particularly related to the well-being during this COVID-19 time. I think Dr. Professor Gautam Gawali sir has given very good suggestions where we can keep ourselves well-being during this critical situation, where we can help even the society also. But here he has focused very interestingly on the relationship with the society, how the people should have the relationship with the society, building confidence among the youth. This is a very important one, where psychological confidence we have to build even in our family, our children, among children, particularly young people. It is a very important one, and proper information also should be given. But where believing all the false information, and even we are more anxiety to watch the TVs all the 24 hours and getting all the information, and which is not relevant or which will make you more panic during this situation. And he also has spoken about the maintaining the physical distance, the whatever it may be, the social distancing made, it is not appropriate, where we have to use this physical distance, and the stress control is also very important one. And interestingly, there was a discussion about the family relationship between the wife and husband. Here I would like to make a point and remember Dr. B.R. Ambedkar quote, what he made. The relationship between the wife and husband should be a closest friend. It should be. Once you are having this type of the relationship, then there is no much differences between the wife and husband, where we have to maintain. This is the other opportunity. This COVID-19 situation, we have to see in the positive way also, where the family together, you are getting the time with your family and having the discussions with all your mother, father, children, and your siblings, and you are spending more time with your family, where you can your relationship and your bonding, your love and affection towards your family also increases. This is the important one, what Dr. Professor Gautam Gawali told, that you have to think in the positive way, where the opportunity we have to see. We should not see this COVID-19 made as very terrible. Instead of that one, you can think it has given the opportunity to stay at your home and also working from the home, even technology also. Previously, I can say even in the Indira Gandhi National Open University, we never had the online counseling sessions previously, and also we never organized this type of the webinars also. But now we are organizing counseling sessions through online using this Google Meet app or other ICT platforms we are using. In this way, we have to see, and we should mentally also become strong to face any type of the situation that we have to teach to our children. That really I was enjoying along with all the people, all the participants of Professor Gautam Gawali sir lecture. Really, I am very thankful to you, sir, on behalf of the Regional Center Mumbai and on behalf of the Indira Gandhi National Open University, New Delhi. And really, but, Professor Gautam Gawali was a very, he has given previously also 2 lectures to our IGNO Regional Center students and our staff also. I am very, whenever I request Professor Gautam Gawali sir, then immediately he will give his consent, even though he is busy. He is having that much special affection and love on me. I am very thankful to you, sir, for spending your valuable time. And during this situation, he is very busy. Even in this COVID-19, he is the director for that Amity University, the psychological department, and he is doing, even after this retirement of this Mumbai University, now he has taken up his task as a director in the Amity University. Sir, I am very thankful to you, sir, and I am also thankful to all the participants, students and the faculty, particularly those who had the interaction, Dr. Dharam and Dr. Karuna, or some other faculty, those who have interacted, Kranti, and the students across the country also, they have participated, from other regional centers also, other regional directors and the other academics from the different regional centers participated. Thank you, one and all. And also, this is a great opportunity, sir, having interaction with you and listening you, sir. Thank you, one and all. We are closing this session. Thank you.
Thank you. Thank you so much.
Thank you, sir.
I think you should think about whatever the Dr. Dharmaji said. Please, I mean, like, if you'll contact, then it will be helpful for everyone, I think.
Yeah, definitely. Thank you for your suggestions also. We will work on that.
Okay,
Yes,
okay.
yes.
Thank you, sir. Thank you, everyone. Bye bye.